I'm Jessica Lemon of AARP Texas, and I am pleased that AARP is a proud sponsor of the Striking a Balance Caregiver Conference. As a sponsor, we hope that you're gaining new insights into family caregiving and that you have the opportunity to connect with other caregivers and experts on aging. Family caregiving is a priority for AARP. It is essential to our work today, but that's not all. AARP is doing amazing things to make life better for the age 50+ populations and the generations to follow. We help improve their financial well-being and their health. We want people to contribute to society and local communities and to fully enjoy life. Some of you may already know that AARP has a strong presence throughout Texas in many communities in this great state, including Austin, the capital city where I live and work. Again, this year, AARP Texas is bringing opportunities to our members and others through virtual events, just like this one that we're participating in today. We hope you have the opportunity to enjoy these free offerings. Not only are there programs to help unpaid family caregivers, but there are presentations to help people avoid being victims of fraud. We host fitness seminars, and we work with city leaders towards making this an even more age-friendly community. And know this, volunteers are critical for our mission. There are many opportunities for those who can give a little time to volunteer. You can learn more about these local happenings at aarp.org/TX or find us at the AARP Texas Facebook page. But again, of course, family caregiving is a priority. There are 48 million family caregivers in the US, 3.4 million in Texas alone. They provide help to loved ones, usually a parent, spouse, or sibling. Caregiving can be anything from driving a loved one to a doctor's appointment, making sure bills are paid, cleaning the house, or helping bathe and dress, and many caregivers do fairly complex medical tasks. Caregivers come from every generation, from Gen Z to the silent generation, and every racial and ethnic group. And you know, most of us will either be a caregiver or need care at some point during our lives. AARP recently released new research on how much family caregivers spend out of their own pockets to care for a loved one. We found that almost every caregiver spends money on caregiving, and about 8 in 10 routinely spend their own money on caregiving. The average amount that caregivers spend each year is $7,240. That's more than a fourth of their household income on average. Housing expenses like rent or mortgage payments, assisted living, and home modifications make up more than half of caregiver spending, followed by medical expenses. Caregivers also experience indirect financial setbacks, often postponing their own personal savings for retirement. But I am here to tell you there's action that can help. Congress is considering a bipartisan bill called the Credit for Caring Act, which would create a tax credit of up to $5,000 for working family caregivers. This could help offset some of those major expenses that we know caregivers are facing. AARP, along with 80 other organizations, endorsed the Credit for Caring Act. Family caregivers are the backbone of our long-term care system, but they are breaking under the pressure. Creating a tax credit for family caregivers is one way that Congress can help. If you would like to learn more about the Credit for Caring Act, visit aarp.org/caregiving. There, you will also find many resources available for family caregivers just like you. So again, that's aarp.org/caregiving. Thank you for listening. Again, I'm Jessica Lemon with AARP Texas, and thank you for all that you do as family caregivers or to support caregivers.
Thank you so much, Jessica. And thank you for joining us for this sixth and final session of the 2021 Striking a Balance Caregiver Conference. My name is Rob Fabian with Age of Central Texas, and along with our long-term partners, the Area Agency on Aging of the Capital Area, we are very excited to bring you this 20th anniversary Striking a Balance Caregiver Conference. You know, for the past 2 decades, we've been bringing you some amazing experts from all over the nation to help you with your caregiving journey. And so we're so glad that you're joining us today because we've got a tremendous session for you. All this week, we've been talking about the past, present, and future of caregiving. And today we're going to have a fantastic presentation on what caregiving might be like here in the immediate future. Before we get started, just a couple of really quick housekeeping issues. Number one, I want to remind you that we are recording all of these sessions, including this one. So if for any reason you need to leave early today or might have tech issues on your side and get knocked off, don't worry. We're recording the session. It'll be available on YouTube later on this week. In fact, at the end of this week, probably on the Monday, we're going to send you a list of the links to all of the sessions from this week, along with materials from the sessions, including the PowerPoints and the handouts that have been discussed during this entire week. Number two, speaking of items to send you, we sent you a PDF of the program for this year's conference. We hope that you take a look at that because not only does it have information about all of our wonderful sponsors and our presenters from this week, but we also curated some fantastic caregiver resources for you. So please take a look at that because there's some wonderful materials in that. Also remind you, right down here at the bottom of your screen is the chat feature. It looks like a thought bubble that you'd see in the comic strips. We want you to click on that, and during today's presentation, be sure and ask your questions, because after all, this is why we are doing these sessions for the past 20 years, is to provide you with the opportunity not only to learn from all these amazing presenters, but also to have your specific questions answered. So be sure and ask your questions during the presentation. And then at the end of the presentation, we're going to have a facilitated Q&A, and we're going to answer all of your questions. So take advantage of this opportunity. Ask those questions today. Then finally, when we send all of the materials to you after the conference, we're also going to send you an electronic survey. We ask you to please take that. It's only going to take about 2 minutes to complete it, but the information is very important for us because we want to know, as a caregiver, what are some of the issues that you're working through in your journey? What are some of the topics that you would like for future conferences? Let us know that information because we honestly read every single survey and we take that information and use it to put together next year's conference. So please take just those 2 minutes and give us your feedback so we'll know how to make this conference even better for next year, our 21st anniversary. All right, it is my pleasure to welcome Melissa Crawford from the Area Agency on Aging of the Capital Area. And Melissa is going to introduce our speaker for today.
All right, thank you, Rob. Good afternoon, everyone. And yes, I'm Melissa Crawford, the Program Manager for the Caregiver Support Programs here at the Area Agency on Aging of the Capital Area. And I am pleased to introduce this session speaker, Bob Stephen. Like many of you, I'm very interested on hearing what is next, or what does the future hold for caregiving. So Bob Stephen is just the person to weigh in on this topic and provide us some insight. He is the Vice President of Family Caregiving and Long-Term Care at AARP. He has dedicated almost a decade to leading AARP's development and implementation of strategy to support all family caregivers in America, whether through advocacy, product services, market influence, digital tools, community change efforts, or consumer programs. Stephen has set the caregiving strategies for the entire nation and established partnerships with leading caregiver and health organizations to increase AARP's impact. He is a leader with more than 20 years of professional experience working in organizations ranging from startup firms to large corporations. He holds an MBA in Finance and Business Policy from the University of Chicago Graduate School of Business. So now, without further ado, I'm going to turn the mic over to Bob Stephen. Thank you.
Thank you, Melissa. It's great to be here. I'm going to start sharing my screen with everybody. See if this works here. There we go. And so again, thank you, Melissa, and thank you, Rob. I'm honored to be here with everyone to talk about the future of family caregiving. And I want to thank the Area Agency on Aging of the Capital Area and AGE of Central Texas. As Melissa gave you an intro, probably more than I was planning giving. I do lead our work at AARP nationally to support family caregivers, and really at the center of what we do is the family caregiver, the individual, making sure that we have the best resources possible, but also community organizations, making sure that we have resources that community organizations can tap into as well. So as we get started, I guess, as Jessica in the video mentioned, AARP has been working on family caregiving, and it's very important to us. We've been working on this for decades. And you might say that family caregiving is part of our DNA. Our founder, Ethel, Percy, Andrus, she was the first woman to become a high school principal in Los Angeles. It was a job that she loved. And she had to leave that job because she was the sole family caregiver for her mother and father. And it was that act of caregiving that then led her on her journey that eventually led to her founding AARP. For myself, this is also a personal issue. And like many of you, I am also a family caregiver. Specifically, I am a long distance family caregiver for my father who has Parkinson's. And I guess my role as a long distance family caregiver is to really support my mother and brother who are his primary caregivers. But as I said, it's not just something that we're doing because of an organization, but it's personal for me and most of my colleagues that I work with. So in terms of the future of family caregiving, I hope that you'll, I guess, go on a slight journey backwards, even though Rob said we've been looking at the past and why we're going to look at the future, because really to understand where we're going into the future, I think we really need to look at what's happened in the last 18 months. The pandemic has been very unfortunate, and but it really gives us insights into where things are headed. And it's changing our lives in a number of ways. And caregiving is one of those areas where we're seeing things change and transform across a number of dimensions. And we'll hit on some of those in the next time together, whether it's work or just even how we're seeing and the way care is going to be delivered. But it's also highlighted issues that maybe we knew were there, but others didn't. and it's made that more visible. And that might also, come into, equity or just things that maybe now are being addressed in the political sphere. So that's how I'd like to approach this as we go through today, and then wrap up with, before we get to your questions, is kind of where we see the 4 big major areas where we think the future of caregiving is going. So some numbers here in terms of visibility, and I know that Jessica hit some of these, so I would promise not to go over them in too much detail, but before the pandemic, we estimated that there were 48 million family caregivers. That's people over the age of 18 caring for someone over the age of 18. And as mentioned, there's over almost 3.5 million in Texas, and a lot of time and effort into that. 34 billion hours a year, $470 billion annually. But the pandemic showed that, unless you had been in the midst of caring previously to the pandemic, chances are caregivers were mostly hidden. And the pandemic, though, showed many of us as caregivers that we're not alone. Suddenly we had just about everyone aware of those in their world who needed care or provided care. Many more during the pandemic have taken on the role. And while we don't have the exact number, one study says that actually 1 in 3 adults became an active caregiver during the pandemic. So it's become much more visible. And in the past, where we may have been focused more on trying to get people to self-identify, think about the role, understand what family caregiving is, suddenly we were very, very visible. Caregivers within that 48 million reflect society. If we look at the cultural breakdown of family caregivers, 40% are Latino, African American, or Asian American family caregivers, just as reflective of society. And later on, I'll talk about what we've learned or what we've seen in terms of that raising, shining a spotlight, if you will, on equity as it relates to caregiving supports and long-term care. And we know that the majority of family caregivers are women, but we can't forget that 4 in 10 are men. And the younger that you look at the at family caregivers, so those younger family caregivers, it's more likely to be almost a 50-50 mix between men and women. We often hear, at least for those of us who work in family caregiving, we often hear people talk about the average family caregiver. And the reality is that there is no average family caregiver. We're all unique. Every caregiver, their situation is unique because of where we live, our loved one's condition, our culture, our age, and so forth. And so we have to look beyond just this idea of an average family caregiver. This is where I really miss being able to be with you in person, because I typically like to be able to do a little bit of interaction. But so I'm going to just ask you to think through this before I go to the next slide, in terms of what your guess would be in terms of how many family caregivers are millennials or Gen Z. And before, as I flip the slide here, think through that in terms of percentage or a number. And it turns out that there's a lot of them. There are almost a quarter of all those 48 million family caregivers are millennials. And then you've got another 6% who are Gen Z. So they're almost 30% of family caregivers today are those younger generations, almost 14 million. And it turns out that these family caregivers are the most diverse generation of caregivers that we've seen. They're also facing some of the biggest challenges among family caregivers. More often, they are working. Relative to older family caregivers, they're more likely to face financial strain, and they're more likely to be facing health strain. They take on responsibilities at the beginning of their young lives, often sacrificing their own futures, taking on debt, pushing off working, or trying to maybe further their careers, and even making social connections. Many of these younger family caregivers are sole caregivers. They're called on to help their family when no one else was available. So we know that they're very important in terms of support, and they're often the family caregivers who are least likely to understand that there is help available out there. A staggering number, at least to me when I saw this, is when you look at the number of family caregivers who are also students. And this can be anybody. It could be an older adult who's gone back to school, but it tends to be in that younger range, the Gen Z and maybe the millennials, but 11% or 5 million. So there are 5 million students, not high school, they're in that college range, who are also full-time family caregivers. Prior to the pandemic, we had started looking at these students prior to the pandemic hitting, and we knew that they were really being squeezed. Majority of them work, they attend school, and they're trying to juggle that with their caring. And they face great difficulty with all of that. There's financial hardship fits in there, having to meet their academics, and then certainly what was most important to them was caring. And then the pandemic hit. And it really has exacerbated the problems that they see. We see greater financial hardships, food insecurity, anxiety, and depression all growing. These caregivers, relative to their peers, are more likely now to have to maybe not go to classes, less likely to be able to attend on a regular basis. And they've really seen that their universities or their colleges or their technical institutes, wherever they're going, really were not prepared to support them. I think this is one of those things that as we look to the future, having support for family caregivers come into locations like schools that we did not expect to see. This is an extreme form of juggling for these students, but I think something that many of us can relate to, particularly those who work, the idea that we have multiple things that we have to keep going at the same time. So again, I would probably at this point ask for a show of hands for how many of you have had to work at some point, or not had to, but have worked at some point during your caregiving journey. Chances are there would be a fair number of you. You wouldn't be alone. 60% of family caregivers work in addition to providing care. It's interesting when we try to get the attention of employers, at least prior to the pandemic, we've had to point out to them that likely if you combine caring for a child and caring for an adult, 3/4 of their employees are probably caring for someone. Sadly, most of that attention goes to those, and I shouldn't say sadly, but in terms of relative to family caregiving, a lot of that attention goes to those who are raising children. But 1 in 5 employees in an organization is likely a family caregiver. And we know that the majority of those who are working and caring for an older adult have had some sort of experience where they've had a work impact. And by that, I mean that they found themselves having to go in late or leave early or taking time off to accommodate what was going on. We found that a majority of family caregivers at work weren't telling their boss that they had those responsibilities because they didn't want to be penalized. And 1 in 10 family caregivers have said that who had been in the workforce say that because of their caregiving responsibilities, they had to leave the workforce, either early retirement or leave altogether. Now, consistent with what I said before about trying to get people's attention, this is an area that AARP and a number of organizations have been trying to get employers to recognize that they play a big role in supporting family caregivers. And prior to the pandemic, we were making some slow progress. Some employers were starting to realize that they had caregivers in their midst. And it was really the fact that there were younger family caregivers that seemed to start to wake up many employers. But as we were getting that ramped up, the pandemic hit. And suddenly, employers had to take action, often leading to greater flexibility. It was just a byproduct of what needed to be done. And granted, at the same time, I'm not trying to say that things were great for family caregivers, because we know that a great number of family caregivers lost their jobs, had hours cut back, or or didn't have the flexibility. They still had to go into work, and despite the fear that they might bring the virus back into the home. But we do know that, I guess if there's a silver lining, this may be one of those places, because caregivers and caregiving were suddenly much more visible to employers. And employers started, because of COVID, but also understanding the needs of their employees, some of them started to offer more paid or unpaid leave. Now, the numbers that you see up on the slide here, these came from a study that we did at AARP with S&P Global. S&P is a financial news organization. We did those probably summer last year in the midst of the pandemic. And we found that, yes, when we were looking at large companies, there were increases in the amount of leave that was being given to employees for these areas, or for these companies. We went back out later in the year and talked to companies again, trying to go beyond leave. What are they doing? And we found that it wasn't just leave, but that there were a number of changes, and some of them were certainly because of the pandemic, but some changes that were very beneficial to family caregivers. I can tell you, if I didn't have to travel anymore, that certainly freed up time that I could spend if I had, same thing with teleworking, if I had that available to me. But I think importantly, it wasn't just those things that were done for simply the needs of the business, but also increases in support groups for family caregivers, employee assistance programs, backup elder care, things that really make a difference for family caregivers. One benefit broker, the folks that help companies with their benefits, one benefit broker that we talked to from one of the larger brokerages said that their estimate was that adoption of caregiving supportive benefits probably accelerated by 5 to 10 years last year. We're much further ahead. And while on the surface, that's positive, but we do see some issues. Number one, as I mentioned a little while ago, there's still a gap that most of what has been done has been for employees who are caring for children. Employers are still slower to understand that they have many employees who are caring for older adults and need help too. So we still see a gap there. We know that not everyone is able to take advantage of all these new benefits. Even at AARP, where many of us had to telework, we had colleagues who, depending on where they were, they still had to come into the office on a daily basis and keep doing what they were doing. They didn't have that flexibility. And we know that exists in different industries. Another one is that small employers don't have the luxury or the ability to afford maybe an employee assistance program or support group. So it may not be available to everyone. And I think the big question right now, particularly as we look in the future, we don't know what's going to remain. What's going to stick with companies and still be there for family caregivers, say next year. So to that, we talked to family caregivers just a few weeks ago, and this is research that was that's about 2 weeks old. And we talked to working family caregivers, and we said, we'd like to hear about your experience in the pandemic. And we found that, and what are you thinking about the future here, the near-term future? And we found, as I think many of you would expect, that there is a great deal of worry. Majority, 3/4 of family caregivers say that they're worried about juggling their work and caregiving as things go back to quote unquote normal. 2/3 of family caregivers were particularly worried about the next year, because even with vaccinations, there's still a concern that, excuse me, if I go into the office, I'm going to potentially bring something back to my loved one. But there was a fair amount of agreement that the flexibility that they got to experience was very positive. And I think the biggest piece that came out of this particular research, and it may be a warning sign for some employers, is that 43%, so 4 in 10 of family caregivers are saying, look, the flexibility I've seen is important to me. And if my employer takes that back, I'm going to potentially look for another job. I think that's something that employers, as they look to going back to the way things were, need to realize that family caregivers are in a different place. And I think that definitely is something that we'll get back to when we talk about the future going forward. So, in terms of one of the areas where it's less of changing the future, but making things a little bit more visible. And one of the reasons that family caregivers are particularly nervous about their loved ones if they have to go back to work is our long-term care system. Family caregivers know that we're the backbone of the long-term care system in our country. And all the faults that are in the system have been on full display for the last 18 months. When the system isn't working, particularly those areas that don't necessarily relate to family caregivers, it puts more and more burden on families. And that's true, particularly when a loved one requires care in another setting, like a nursing home. We all watched as the pandemic swept the nation. As of the last time I looked at the numbers, 184,000 residents and staff of nursing homes and other long-term facilities have died because of the coronavirus. And sadly, that number is still growing. That's about a third of all cases in the country, of all fatalities in the country. For family caregivers with loved ones in facilities, they couldn't see their loved ones and were unable to get answers. There was no transparency. And from a national perspective, the rules often differed from state to state in terms of when visitation might open and what might be available. And many family caregivers made the decision either to take their loved ones out of facilities or to avoid facilities altogether if someone needed that, and to take on more care at home. We were all reminded that every time that we ask a family caregiver or we ask older adults, where do you want your loved one to receive care? Where do you want to receive care? The answer 90% of the time is, I want to be at home. I want to be in my community. And this was a big reminder of that. It also, as we looked at this, it highlighted some of the disparities, particularly in the African American and somewhat Hispanic Latino community, because we saw that early on, those facilities across the country that were more likely to have infections and have deaths tended to be those facilities with African American, Hispanic Latino residents. And so it was a reminder that there is inequity in terms of the quality of facilities from community to community. So just really highlighting some of the things that we know have been there, but now has brought it more into light. As nursing homes struggled, staffing has remained an issue. This was also true for those whose loved ones were at home. It's not always possible, particularly and currently, to find home care workers if that's something that the family feels comfortable with and it's appropriate. And we saw that more and more of the responsibility was falling to families. And this is really not new. It just became a little bit more exasperated by the pandemic. So if we look at, let's start with family caregivers first and families. If we look at just simple demographics and where things were headed, we have more demand for family caregivers, and yet the number of available traditional family caregivers is decreasing. So if you were to, one way to think about it is if you were to add up all of the people in the United States who are over the age of 80, that's typically when we really expect long-term care to be needed. And then you compare that to the number of people who are between the ages of 45 and 64. That's maybe traditionally been the group that typically takes on caregiving responsibilities and create sort of a ratio, if you will. Well, if we went back just about 11 years ago, back into 2010, you would have found that there were 7 people in that 45 to 64 range for every 1 person over the age of 80. Well, because of the changing demographics, now as we look ahead to 2030, so 9 years away, we're going to be looking at 4 people available for every 1 person. And then if you look 20 years out beyond that, it's going to be 3 to 1. What that means is that, number one, when we went back and think about the visibility, and I talked about the younger generation, it means that caregivers are going to be younger, but they're also going to be older. We're going to see people well over the age of 75 becoming more common, caring for example, a spouse. We're also going to see many more family caregivers taking care of more than 1 person. We know that happens today, but that's just going to be the nature of, as we're looking at it. And we did see some of that within the pandemic, and talking to United Way and the 211 programs across the country. They're telling us that they're seeing a very much an uptick in the number of caregivers who are caring for multiple people, something they haven't been seeing to the same degree previously. So that's the caregiver side of things as we look forward. What about the paid workforce? Now, these are people who work in nursing homes or home care agencies, and generally it's a tough job, and it's one that is usually underpaid, and they're dealing with understaffed conditions. Estimates suggest that there are about 4.5 million of these workers in the country. And because we have increasing demand, but also there's a lot of turnover, people leaving because as I said, it tends to be very low paid. Estimates show that we're going to need about 200,000 new people into these jobs every year. We're not keeping up with that now. And as we look into the future, that gap in terms of the available paid workforce is going to continue to grow. And we saw that become very extreme in terms of the pandemic. There were workers who did not want to go into to facilities potentially, and we know that right now when we look at it across the country, it's almost a quarter of facilities across the country are understaffed. Now in Texas, it's not to that degree. The last data that we looked at was roughly about 10% of nursing homes in Texas were understaffed, but it is a national issue and something that we are going to need to address. So an area, and I'm going to switch from an area that kind of exposed some issues back to what may be changing, and care is changing, and this is again a little bit of a mixed bag because there's more that is being shifted over to family caregivers, but there's some definite changes that we need to be prepared for. But if we think about it, there's fewer people taking care of their loved ones, and greater responsibility being shifted onto to those family caregivers and those paid caregivers. And so we need to, as we look at this, we have to be very cognizant of how it's shifting and changing. There's been a lot that has happened in the last 18 months that we need to make sure that we're doing what's right for families as we go forward. So the first thing, and the first part of this, is the impact of missing caregivers. So I'm guessing for most of us, we've probably been in a clinical setting, like a hospital, physician office, or maybe a diagnostic center with those that we care for. As a family caregiver, that's one of the jobs that we do. We advocate, we listen, we make sure that we know what's expected as it relates to the medical care for our loved ones. And prior to the pandemic, there were some settings, hospitals, some certain hospitals and health systems and clinicians, doctors who were really good at working with family caregivers, with us. But there were a number of others who weren't. They saw us as just merely visitors or someone that was in there bringing the person in that they were treating. And that's one of the reasons why a number of states, including Texas, implemented the CARE Act to make sure that at least among inpatient hospital patients, that their family caregiver was recognized and was given different training and advance notice. As I said, that hasn't been universally the case across the country, that all hospitals and all doctors and facilities have treated family caregivers as more than a visitor. But then the pandemic came. And in most cases, we weren't allowed in the facility, let alone in the room with our loved ones, whether it's a hospital or in a nursing home. And that was not, I mean, that was heartbreaking, and it was very hard for us to have to deal with that. But here's the thing, we weren't the only ones that noticed that. There were a lot of healthcare leaders noticed that we weren't there, and that they noticed that because of our absence, there was an adverse impact in terms of both the patient and our staff. And suddenly we had hospitals and health systems who maybe had been a little resistant to working with family caregivers, finding ways to get us back in there. We saw cases where one hospital system in Illinois decided to invest in tablets so that they weren't, with the law within Illinois, able to bring family caregivers in, but they could make sure that there was that virtual connection. It's not the same as being there, but it was something. And in others, they worked with their state to actually create a designated caregiver who was not the same as a visitor. So the hope here is that this leads to permanent change, that people don't forget, and that going forward, we're not just visitors. So that's one positive way that, out of some pain, we're hoping that we're going to see a change in how care is delivered. If we go back to the faults of the long-term care system, for many who remain at home, community-based services are critical to both the adult care recipient and the family. I mean, this is a way that, as I mentioned, that 90% of folks want to have their loved one at home, and 90% of older adults want to remain at home. Community services are critical. And yet the pandemic showed us what happens when those disappear or are severely limited. And because overnight, we didn't have the ability to have adult day services, and other services had to change radically. Meal delivery had to go from fresh meals to eventually shelf-stable meals. And so there was a greater recognition, I think, that has come from this in terms of the importance of these services, which hopefully will help sustain them going further. It also showed the creativity that can come out of these. One thing that we've seen is, I think, an example of what we're doing right now. The virtual programming that became much more common. I think it's also another area where, when we look at the impact on limited services and how that differed from community to community. Now, just as with nursing homes, communities of color have always been more likely to have fewer of these services available, and particularly that was true in the pandemic. And so hope is that at least this is one of the priorities for AARP, is to look at how do we make sure that there's equity in the types of community services that are available across communities as we go forward. So I mentioned virtual. That brings me to the role that technology is playing. And whether it's the virtual services for maybe coming from a community organization or within the family. If you're like my family, and it may be a case that we're spread out. I'm in Washington, D.C. My family is in Southern Illinois. If you may have noticed that you're using technology a lot more. For my family, we started Zooming because I didn't feel comfortable coming to visit my parents because I didn't want to bring anything with me. And so we started using Zoom to be able to stay connected. It felt better than a phone call because we could see each other. But we also found that we could, for my parents, we could get groceries delivered, and occasionally get a meal delivered in as well. And we just found that technology, everyday technology, became much more ingrained in how in doing things in ways that we hadn't really thought about with our caregiving. So it's interesting. The quote that I have on this page, the technology adoption accelerated by 5 to 10 years. I know that that's just almost identical to the one that I mentioned on benefits. So I don't know if this is a case where all the experts, when you ask them about the pandemic, they're all going to say it accelerated by 5 to 10 years, but it does feel right that our use of technology has changed. And one thing that we've seen is as we take a step back and from an AARP perspective, we can look at kind of the startups that are out there. And I feel a little bit bad saying this, knowing that Austin is a big hotspot for technology, but a lot of startups and investment has gone recently in the last 18 months into companies where an entrepreneur had an idea, but they weren't a caregiver and they didn't talk to caregivers. And but it was an idea that was going to change this caregiving situation that they read about and maybe knew about. And it maybe just wasn't the best thing for family caregivers. We found that there were people trying to come up with, for example, maybe grocery delivery services for family caregivers when we're just as off easy using what we already have within there. So I kind of see it as one of those positives, but that there's at least attention being paid to the technology space for family caregivers. But I think there needs to be this recognition that there are already things that we're using and we figured out how to use using technology that are ingrained in our life. So just one kind of an aside as we're looking at that. And I'm kind of curious, and if you want to share something in the chat in terms of ways that you have maybe used technology, that would be interesting. I think just even to help spur some of the thinking we have, but maybe others will see that as well, and we can highlight that. So if you want to do that, that would be fantastic. And otherwise, I'll keep moving along then. One of the ways that you might have seen technology play a bigger role is, I see iPad and YouTube for activities. Absolutely, there. That's one of the ideas that just popped into the chat. This is less fun, I guess, but telehealth is probably one of the areas that many of us have experienced technology, and particularly as it relates to caregiving. The numbers, when you look at them, are certainly kind of staggering when you look at it. That from 2019, 11% of visits were happening on telehealth, and it went up to almost half. And that just between February of last year and April, the number of people using telehealth went up by 78 times. So it could certainly be valuable. Now, there were some bumps early on. We talked, I remember recently talking to a health system up in the northern Midwest, and they were describing how they had some issues going on with when they first rolled this out. They weren't ready, and so they went really quickly. And they found that early on, many of their doctors were experiencing issues where instead of helping patients with their case, they were having to do tech support because things were just rolled out fairly quickly. They've gotten some of those bugs worked out. So the hope is that that has made it a lot easier, so that instead of us all having to do tech support for our loved ones or working to make this happen, that we can actually reap the benefits of telehealth. And I think the benefits are there. It doesn't replace going in person, but as someone has just pointed out here, that and not everyone is comfortable with technology, and we have to keep that in mind. And we also know that in rural communities, technology and telehealth may not be an option for because of broadband not being available. But where it is, it can be helpful for some things. Some of it is, certainly no transportation required. We've seen that the working caregiver in certain systems can be included, so you can do a 3-way call so that you're there to be able to listen in. And maybe if it's not something that your loved one is comfortable with, what we have heard from talking to some insurance companies is that they've seen an uptick in younger adults and caregivers being able to use telehealth to better take care of themselves. Things that they didn't have time in the past, but now because it takes maybe 5 to 10 minutes, that they're able to keep up. So there are some potential benefits there, but we have to keep it balanced. And as another great point that has been raised on the chat as well is that it really helps overcome in terms of the difficulty sitting in a car or if they're in great pain. It's there. I think the key here is how much of this is going to stick, and are we going to retain the ability to have coverage for telehealth, and is there going to be this ongoing commitment to make it available for us? One physician that I talked to recently was sharing with me that he was frustrated because he'd been using telehealth and managing to treat his patients that way. And his hospital decided that they really wanted him to be doing telehealth in his office instead because they didn't like his office sitting empty. So that's the type of thing that we have to overcome there. And telehealth may be the tip of the iceberg. This is where I really see when we look at the future, home is it's where healthcare has been, but it's also where healthcare is going in terms of the next care frontier, and family caregivers who we're already providing care, and we're part of the care team, but our role is going to get more and more important. There's been the way that medical professionals have explained is that there are a number of things that could be done in the home that have been possible for 20 years, but they just weren't. And that was for a number of reasons. One, consumers just weren't comfortable with it. If you tell someone, well, you can have a procedure done at home, or you can have a procedure done at the hospital, I think most of us probably would say I'm going to feel safer in the hospital because that's where all the medical professionals and the equipment is. But yet, so there was that consumer acceptance. Hospitals and health systems had built expensive facilities, and they so needed to pay for that. And then certainly there was regulation as well that it wasn't always possible. But all of those things changed last year and this year. There was more acceptance because you could get things done in the home that perhaps weren't possible in terms of going into a facility, and hospitals needed to deliver, and health systems needed to deliver care, and regulations were waived. And now we knew that things were shifting already before the pandemic. AARP had done research that showed that as of 2019, almost 60% of family caregivers were doing what we would call medical tasks, things that in the past had been done by a nurse or a medical professional, but was now being asked of family caregivers, things like changing wound care, things of that nature. And that was already falling to family caregivers. But now we have even more shifting to the home. For example, hospital at home for certain conditions. Now, thanks to a waiver program, at least last time I checked a few weeks ago, up to 30 states are now allowing that, up to 120 hospitals. Now, there's a waiver that they need for that to continue within Medicare. We'll see if that gets renewed. But there's been opportunities not readily available for everyone, but dialysis at home, chemotherapy at home. And as you can see from the quote up there, for those forward-thinking health system executives, there's the thinking that there's just about nothing that obviously there are some things, but many things that are going to be able to be done at the home. Now, there are some positives just with telehealth. We have the convenience aspect. Suddenly, if you don't have to, I know, having gone through some medical care myself, the having to have the the case where I had to be somewhere at 6 a.m., which means being up at 4 a.m., the convenience of having to get in to a facility and not have to leave your home can be good. For many patients, it's a setting of choice that they have, that I'd rather be at home than go into the hospital where I might, it doesn't feel the same. Cost is better, and then also the outcomes can be have been proven. There's been research that shows that home-based care has good or better outcomes than other care. I think the negatives come to, we just don't know about safety. And I think the other piece is that when we look at it, what we're really concerned at from an AARP perspective is that a lot has happened quickly in the last 18 months. And a lot of this seems to be shifting onto the caregiver and the family. When we talk to those involved, for example, in hospital or home, we say, so have you thought about the family caregiver? Doesn't this shift more to them? Because you're not going to have staff and people available full time. Who's going to do the monitoring? And they acknowledge that there might be more there, but they haven't really thought about it other than saying, well, they don't have to drive and pay for parking. And that's so we need to make sure that from a family caregiver perspective, we're not having everything just shifted to us to the benefit of insurance companies and so forth. So I think that's a real key one, and I'm going to come back to that when we talk about where we go in the future. Because as we're talking about shifting things, we already know, and I think this is one of the questions that we'll get to, caregivers already pay a significant cost. And it's time, it's health, it's money. And we have to be very clear that we're not going to, we can't go further by just shifting more and more onto families. Now, these are, so when we look at cost, as I've already said, 34 billion hours per year. And if we were to average that, about 24 hours of care per week that a family caregiver delivers. And we know that again, that's the average. There are many more who provide much more than that. With research, we know that from asking, in this case, working family caregivers, 2/3 of them said that during the pandemic, they end up having to spend more time on their family caregiving. And for all the things that we've talked about, services that weren't there, that they needed to do. And so, as more and more got shifted to family caregivers, that obviously led to more people spending their time there. Next one is stress. Prior to the pandemic, 1 in 4 family caregivers reported difficulty taking care of their health, and 21% felt that their health was poor. I think another key one here, 36% said that they felt high emotional stress. And so add in the pandemic, we're now looking at 80% of family caregivers saying their stress has gone up. So family caregivers are paying a price there in terms of their stress and health. And then finally, in terms of money. And if you were on for the video from Jessica with AARP Texas, you heard these numbers and it's not a surprise. I've seen some of the questions go by. $7,000 on average that the caregivers are spending, and depending on where you're at, that might be a quarter of your income, but we know that for some people it's 50% or more of the income. And that these contributions personally are going to continue to grow, and that already at this point, half of family caregivers experience a financial setback, such as having to dip into their personal savings, cut back on their own healthcare spending, or reduce how much they save for retirement. And this is really an area that we really don't talk a lot about. I mean, you think about the expenses that we have here, these are household expenses. These are personal care expenses. We're not talking about paying for a nursing home in this case. We're talking about paying for prescription drugs for our loved one. And again, it's something that we don't do a great job of planning as a society for our future. And when we do, it's typically not about things that we need to be prepared for. The simple things, just what are the things that we need to expect and need to be able to budget for, and what help is out there. So these costs are definitely there. Which leads me to the political side of things. And I guess there's a positive here in that politically, a lot of the government is starting to, I guess, see the same things that that we've just been talking about here. And the good news is that caregiving is a bipartisan issue, both federally and then we'll show in a second the state level. About 3 years ago, the Congress and then President Trump signed into law the Raise Family Caregiver Act. Bipartisan, that created and dictated that there's going to be a national strategy to support family caregivers. We should be seeing the results of that sometime in the next, hopefully 6 months to a year. And as I'll talk about in a second, even more to come. At the states were way far ahead of this in terms of the bipartisanship and understanding how important family caregiving would be. The slide that you're showing out here just shows 2021. Every state that is filled in red is a state that enacted either legislation or regulation that benefited family caregivers. If we looked at last year, every single state and territory would have been red. Caregivers, we've seen so much activity growing at the state level since 2015. It's a positive situation, and it is bipartisan. And a lot of it is driven by the fact that so many politicians actually have their own family caregiving stories, and they understand the costs that we're talking about today. Jessica also mentioned the Credit for Caring Act. And so I'll just one more time talk about this, but given what we just talked about, $7,000 and some of the things that are out there in terms of breaks for family caregivers, again, bipartisan. For those of you who know politics, I'll tell you the co-sponsors of this include Senator Ernst and Senator Capito, both Ernst from Iowa, Capito from West Virginia, Republican senators. Senator Bennett from Colorado and Senator Warren from Massachusetts. You wouldn't necessarily think of Senator Warren and Senator Ernst in the same sentence, but they've come together to look at this. And this is something that hopefully will happen this year. We just saw polling data that shows that 90% of adults who vote support this type of a tax credit. And while it is just at this point for working family caregivers, it's a starting point, and we know that much more needs to be done. Workforce is another area where we're seeing movement. There has been some attempt to address improving things for the workforce at the federal level. That maybe get bogged down a little bit. There was some that was related to infrastructure, but again, the states are leading the way. We're seeing that this past year, we looked at it, 8 states across the country were addressing workforce in some way. 3 of them passed laws that do everything from give more training to paid long-term care workers, addressing the pay issues that they have as well. And then home and community-based services, those services that help people stay in their home or community. We saw from the last stimulus act that states have the ability to increase the amount of funding that goes towards their Medicaid home and community-based services. So in lieu of funding those services more, instead of traditionally the way that it's been done has been funding of nursing home services. We know that 30 states have been working on this. 17 have secured some sort of a passage of increase. And in Texas, you've been in a better situation in that more than 50% of your Medicaid funding has been going to home and community-based services as opposed to nursing homes. Yeah, I could keep going on and on here with the political, but know that there's more that I didn't cover, such as nursing home quality, financial protections, paid leave, all that are being addressed across the country. So the bottom line here is that I think the things that we have experienced as pain points are being seen by our elected officials, and hopefully that continues. So gone through a lot, and I just want to wrap up with what does the future of caregiving pretend? What is it? And while there's a lot that we could talk about, I want to focus it on 4 areas. Number 1, the future of caregiving is more visible. We have been seen. We're going to continue to be seen. And we're going to see that caregivers are increasingly younger, more diverse, and older. And I think in terms of us and the things that we can be doing both for ourselves, but also future generations and those caregivers who come on after us, it's connecting. And typically, the recommendation I would make is find somewhere else where you can connect to other family caregivers. You're part of this event, which means that you're already connecting to the great activities that Age of Central Texas and the Area Agency on Aging have. But from your role as a family caregiver, knowing that often when people come into this role, they're not prepared, and that they don't have to reinvent the wheel, particularly if they have others connecting and helping them find a way. So that visibility. It's also going to important, I think, as we're looking at a greater push for equity to make sure that no matter where you live, you still have the same access to good support services for family caregiving. Caregiving, unfortunately, is going to be more costly because of those shifts that we've seen. And for here, there's not a magic bullet. There are things that we can look at from the political side of things. I think one of the things that we found at AARP is it's helping people plan with simple tools. We created and we released in January a free financial caregiving workbook for family caregivers that goes into everything from a budget to going through your plan in terms of who's going to offer support and making sure that you think about your self-care. Like I said, that's free and it's available in English, Spanish, Chinese, and for veterans. Caregiving is more and more in the home. We're going to see more and more shifting over to care in the home. You can see the technology and the connection there. I think the big thing here is just as you would advocate for your loved ones when you're when they're in the hospital, make sure that you're asking the questions there, and that there has to be that role thought of for the family and training available. And one of the things that I'll share on the next slide, and it'll be available when you all get it in the later this week, the link to it, is a group of organizations, including AARP, has been working with nurses to develop training videos that are free for family caregivers that talk about how to do some of these advanced things. So know that there are folks that realize that you're being asked to do more, we're being asked to do more, and that we need help. So looking for that. And then caregiving is, and this is kind of where I feel the most hopeful. Hopefully, there's a lot exciting as we go through, but there's a lot that we have to face those challenges. I think caregiving is more empowered. And I look at it and some of the changes, the things where we hadn't been seen, and now, for example, at work, that as employers who don't provide the flexibility and realize that they have employees who are going to be they are caregivers, that they may lose some of their best employees to organizations who offer those, and that they're going to be more willing as an employer to listen to their working caregivers. Certainly from the care team, we're not visitors, but we are part of that care team as we go through it, and then the politicians. How is it that how we're being heard, and we are a political constituency, and that's some clout that we have to use. And certainly AARP has things that Jessica mentioned that you can go to, but I think there are things within the community you can look to make your voice heard. So this will be available instead of trying to copy everything down. This will be available to you in the as it's sent out, but a list of things. Certainly the first place to go would be Age of Central Texas, and certainly I apologize not having Area Agency on Aging in the capital area on here, but you're already connected to two fantastic resources. And then there may be others that AARP might be able to help you with, such as our free workbook. Everything that we offer for family caregivers is completely free and available to anybody. So with that, I want to conclude my formal part of my presentation with a big thank you to all of you as family caregivers for everything that you do. And I particularly want to thank Aegis Central Texas and the Area Agency on Aging of the Capital Area for inviting me and for having this amazing conference that has been going on for 20 years. That is just fantastic. It's been a privilege for me to spend time with you. I wish I could have been there in person, but perhaps some other time. And if someone talking about Prepare to Care is another of those great resources that you can get for free, available to anyone in multiple languages as well. So I believe we now have a little bit of time for questions. Me.
Yeah, thank you, Bob. That was very informative, very good information. Couple of questions in there relate to financial issues. Are caregivers ever going to see a financial break? Is one of them. Another one is, are there any efforts being made or plans to help non-working family caregivers financially? So those are kind of hand in hand in a way.
Yeah, they are. Those are great questions. Certainly the tax credit is a starting point for those working family caregivers. We've seen that in different states there have been different approaches that have been tried. Arizona is trying a grant program to family caregivers. It's not a lot of money, but it's something that is being tested and tried there. And so there may be, as we look at it, other states that begin to look at things. But the key is, particularly for family caregivers who maybe they can't, they don't want to work because they're focusing on their loved one, or they can't juggle the two. That is definitely an area of focus. We've seen some interesting programs that are out there. One is so if your loved one has Medicare Advantage, there are some, I'm not saying this is widely available, but it's something that is being tried in certain markets and it seems to be working. We're seeing that in some markets, Medicare Advantage is allowed is bringing in home care hours for the older adult, but they're allowing the older adult to designate their loved one, the family caregiver, as that person. And so that is one way to be able to be paid as a family caregiver. As I said, it's not a lot, but it's one of those areas to see. And so that's an area that it's not quite, I see a question that just popped up there. It's not quite the same thing as having all of the home care needs be paid for, but we're seeing, as I said, it's in that Medicare Advantage where they're seeing that there is a benefit to the insurance company for them to provide at least a certain number of home care hours in some instances to support the person who is at home. And but it's not going to be the same as, for instance, like you had long-term care insurance. But on the other, we hear you loud and clear in terms of non-working caregivers as something for them, and that's one of our priorities, is to make sure that we're looking for those opportunities and looking to advance legislation and support that.
Okay. And so you just touched lightly on the insurance policies. The question is, I would love to see home care being paid for by insurance policies. Any thoughts on that possibility?
Yeah, it's I would agree with you. I would love to see it too. I don't know that I see it other than those short-term hours that I just mentioned that might be coming. But yeah, definitely long-term care insurance, but it's very complicated. There might be others as well that you all might be able to support in terms of finding programs that might be available locally.
Bob, you touched on the Caregiver Act that was recently signed into law. Can you explain that a little bit more for the folks who are not aware of what that was and what is entailed within that, and as caregivers, what their rights are?
Right. And I will caveat that by saying that there are slight differences from state to state. And so I will describe generally what it does, and that there may be some slight differences in Texas, but generally it's a fairly simple act. It says that when someone is admitted to the hospital, that they need to be asked who their family caregiver is, and that family caregiver is designated somewhere in the record. It might be somewhere in the medical record, and they're doing that for two reasons. One, want to make sure that we've all heard the horror stories and maybe experienced it, where a loved one gets discharged, and as a caregiver, we don't hear about it until mom is sitting waiting for, she's been waiting for us to come to pick her up. So we need to be given advance notice in terms of when that discharge is going to happen. The other is that if there are any of these medical nursing tasks that need to be performed, that we are given at least some sort of instruction on that. So before discharge, we're told, shown this is what you need to do. And it may be that, you have a nurse walking you through that. It may be that they show you a video, but you're given some sort of advance notice so that the first time you even have to think about it, you're at home. So it's having those, that you have a right to be recognized as the caregiver, and given that advance notice, and then given the training in terms of the things that you're going to be doing.
Yeah, I know that from personal experience, that has made a big difference for caregiving in my situation. My father had a stroke, and when we were at the hospital, we made sure that they understood that mother was his caregiver of record. And it made a big difference in the fact that they did take the time to ensure that she understood what was happening, got copies of the medical records, that they showed her how to do everything that would need to happen once he left rehab and got back home. And it did make a big difference.
That's great to hear. No, and that's exactly why, because far too often that was not happening. And now I think there's just maybe 2 or 3 states across the country that do not have the same law. Everyone else has that. That's great.
In Jessica's video, she talked about the proposed legislation that AARP is helping to direct. Can you just give us an overview of what that might look like if it were to be passed?
I can give you a high level, and when I say high level, it's because what I'm learning about Washington, I've never been a political person, and I'm learning that it's quite messy, and they often don't know the details until they work through it. But in short, family caregivers who are working, and the working is important because of how it is paid out in terms of a tax credit. And I believe you need to have income of at least $7,500 to qualify. So not a lot. That there will be certain expenses that you can that count towards this, and that's one of those things that is still being refined, is what counts. It might be, if you had to buy durable medical equipment for a loved one, had to make changes to their home, those things that would count would then be identified, and based on that, you would qualify for up to a $5,000 tax credit that would come back to you. And so, yeah, as I said, the specifics are still yet to be worked on in terms of what counts and the mechanism, but it would be simply a $5,000 tax credit for those with some working income that would come back to family caregivers.
That is really fantastic. I'm really hoping that will come to be. Got a question about how families and family caregivers could benefit from having resources given to them at the doctor's office once a diagnosis is made. We've had a lot of people who come to both Age of Central Texas and the Area Agency on Aging who say, I just got Dad got a diagnosis of Alzheimer's, and they just said, good luck. What kind of work is being done within the medical industry to help the medical professionals understand that the family caregiver doesn't have the same background knowledge as the doctors, and so we need to be pointed in at least some direction on what comes next?
This is an excellent point, and it's one that we've been working on for quite some time. And I've also got my personal experience when learning several years ago about my father's diagnosis, and then then it was all up to us to go figure out what came next and where we went. So we've been working, because one of the things, when you talk to family caregivers and then you say, who do you trust for information? Two things come up all the time. One is, well, I trust my friends and family. The other is my medical professional. And so we've been looking to get, what's it going to take to get things into the doctor's office, the hospital setting as well. And we find quite a few roadblocks. So we actually, we're hopefully working on something that's going to change that. And it's live right now in Wisconsin. And we're hoping to get it in other places, where we sat down with the people who actually have to give out information. So it's not going to be the doctor necessarily. It's going to be someone in their office. It's going to be maybe a discharge planner in the hospital, to find out what would make it easy for you to actually give out this information to someone. And so learning, what does their job entail, the things that they didn't want to do. And then we've created a real simple website service that allows the nurse or whoever it's going to be to say, okay, I'm going to click off a few things that you need, and now I'm going to either text that to you, or I'm going to email it to you, whatever you want, however you want it, we're going to get that to you, and it gives you who you need to contact, the information that you need to have. We're hoping to make it as easy and free as possible, so that it becomes impossible for physicians and folks to say, no, we don't want to do that. And we've been working with healthcare professionals on that. So, my hope is that, others may be doing the same thing, but it needs to be, can't just be an AARP thing. It has to be something that is spread out there and made available to folks. But and I saw as new moms are sent home with, I saw the comment there that yes, new moms are sent home with quite a few things. That's why can't we do something for family caregivers to make that available? And yeah, so
Yeah.
Yeah.
I know that both at Age of Central Texas and the Area Agency on Aging, we work diligently with our healthcare professionals to make sure they know that our resources are available in the community, so that when they do have a patient or family who needs the
Right.
help. But we all know that the turnover is huge in the healthcare industry. And so we're constantly having to go back and repeat and fill in the blanks again. So it's an ongoing battle for us as nonprofit organizations with
Right.
limited budgets and availability, to be constantly having to do that. So it's great to know that something's happening on a higher level as well. And hopefully,
Right.
we can meet in the
It
middle
needs
of
to
that.
connect up there. Yeah. And like you said, yeah, it needs to make it almost to the point where no matter who leaves, that it's just, well, yeah, I know I have to do that. That's an automatic piece there.
Right. That would be fantastic. Bob, I want to thank you so very much for spending your time with us. I know that you are a very busy person, and we so appreciate your knowledge, your expertise, being able to bring all of this together for us, so that we kind of have a better idea of, for all of us that are caregivers, what's coming down the pike. COVID threw us for a loop, and it was something that none of us expected to happen, and none of us were prepared for, and all of the difficulties that came with it. And as caregivers, that was just one more thing to add to our list of
Right.
what we have to deal with in our lives. And so I think we're all a little gun shy of what's happening next. But it's wonderful to know that organizations like AARP have our best interest and are really working and looking out for us and trying to help us as caregivers, so that no matter what life throws at us, we know that we've got a lifeline there to help us out. And for everyone at home, we thank you so much for joining us this whole week for all of these amazing presentations. We want to remind you that no matter where you are in your journey, Age of Central Texas, Area Agency on Aging, AARP, all of these amazing organizations are here to help you. And I say this all the time, and I'll repeat it once again. Please remember, there's never, ever any shame in asking for help, because all of us need help at some point in our life. And in this journey as caregivers, things come up that we have no earthly idea what to do. That's why these organizations are here. It's to help you. It's to help me in our journey of taking care of our loved ones. And so We hope that this has been a very wonderful week for you. I know it has been for us. We hope that we've provided you with some information that can make your day, your weekend, the rest of this year easier for you. I want to thank Bob for joining us. I want to thank all of our speakers. I want to thank the Area Agency on Aging for being our wonderful partner for 2 decades to be able to bring this to you. And specifically, I want to thank you, the caregiver, for taking your time to be a part of this. We know it's very hard to carve some time out to learn about new things and for the help, but I thank you for doing that. I hope that you have a wonderful rest of your week, a great weekend, and anytime you need us, you know where to find us. Thank you so much, everyone. Have a great rest of your day.
Thank you, Rob.